This is your home of independent, fearless, and credible journalism. It's a beautiful Wednesday afternoon. Welcome to The Pulse. We are coming to you live from our studios in Kokomlemle on your digital terrestrial TV because we are free to air. We're on DSTV channel 421 and GoTV channel 144. Welcome once again. And remember that this is brought to you by Dignilu. But this afternoon, we hear from everyone that matter on the vaccination campaign. With just 2 weeks to end the mass vaccination, why are people not out in their numbers? What can be done? Also, halt laptop distributions and refund our money. Some teachers hit the streets in protest of the ongoing one teacher, one laptop policy.
Since that GES have to look at those concerns and address them. One of these concerns is that we believe that the company that produces a laptop, the K technology, does not have the pedigree to do that, and that a competitive bidding should have been done instead of sourcing for one company.
We have live updates from that demonstration by some teacher unions. Plus, our build-up to Christmas continues right here on The Pulse. I am Emefa Apawu. Make sure you hit us on all our social media platforms with the hashtag The Pulse. My personal handle is also Emefa Apawu1 on Twitter. But engage with us because we are also live on all social media platforms, including Facebook and YouTube. Please stay with us. We're right back on The Pulse.
Hello, my name is Nathaniel Atto. You can catch up with all the fun and inspiration on the Joy Sports link here on Joy 99.7 FM, together with all other shows over and over again. It's very simple. All you need to do is go to myjoyonline.com/podcast and relive all of those fun moments over and over again. Joy 99.7 FM, your radio for discerning listeners. Joy 99.7.
Welcome back and many thanks for your company. We start with this rather concerning issue. It's exactly 2 weeks to the end of the nationwide mass vaccination program against the COVID-19 pandemic, even though we're told that January also they will ramp up activities for that. But the exercise is part of a raft of measures introduced by the Ghana Health Service to ramp up vaccination towards the country's 20 million target by the end of 2021, even though that has been reviewed. It's been successful so far, except in some few places where vaccine hesitancy and misconception have slowed down the update. Last night, manager of the expanded program of immunization at the Ghana Health Service, Dr. Kwame Amponsah-Chiano, spoke at an event organized by the Center for Social Justice, where he reviewed large quantities of vaccines are going waste, especially in the Volta region, following people's refusal to take them. We'll hear from him and other experts and our correspondents in parts of the country as we get everyone eligible to go to the vaccination center and take the jab. This evening, President Akufo-Addo is expected to make some key announcements when he addresses the nation on the pandemic for the 27th time. That will be live here on the Joy News channel as well as on Joy 99.7 FM and all our platforms. But we'll start this afternoon by hearing from Dr. Kwame Amponsah-Chiano speaking last night at the CSJ event aimed at preparing the country against the Omicron variant of the virus.
We had a lot of vaccines in the Volta region. Unfortunately, because of hesitancy, we had a lot of them expiring. And so we will be happy if senior people like you would support the Volta region in overcoming hesitancy. We made a lot of vaccines available. You realize that most of our, quite a number of our vaccines expired in Volta region, unfortunately. It's not that we didn't make vaccines available.
So that's the concern of the expanded program director. But just 2 days ago, you recall that JoyNews' Michael Ashali was in Bukum to speak to some residents on the vaccination. Here's what he found.
Many people walking around without the fear of COVID-19. Social distancing here is almost impossible because of the dense population. Unfortunately, that is the situation in Bukum in the heart of the Greater Accra region. COVID-19 was first recorded in Ghana in 2020. 2 years down the line, the fears and misconceptions linger, hampering the collective effort to prevent unbridled spread of the virus. Wearing of nose mask, regular washing of hands, and social distancing were encouraged as a medium-term solution to stop the spread. But in Bukum, wearing of the nose mask is not adhered to. Some don't believe the virus exists.
I don't believe the virus is killing anyone in Ghana. I've only heard of it on radio and seen it on TV. To be honest, I have not seen it.
Assemblyman for the area, Carlos Mancata, says the assembly has done a lot to educate the people on the need to wear their mask, but it is apparent the education has not been enough.
But as the assembly, since COVID last year to now, we've tried our possible best. Personally, I've shared more than 1,500 nose masks, both the used one and the medical one, we used to call them, through last year to now. By then, we were having our former mayor of Accra, the person of Honorable Mohamed Ajisowa. We use our information van to come to the various electoral areas, announce the COVID, educate the electorates on what COVID is, and also the symptoms, so that in the near future or along the line, when you see some of these symptoms, you just rush to the nearest hospital. So, as the assembly, we've done our best, and as the assembly member for the electoral area, I've also done my best. We still continue to educate them so that they can max up, because most of them, for the vaccine, I can see they've not gone for the first and second jab of the vaccine. So, personally, I myself, I've gone for my jab already, and I'm waiting for the second one. Like I said, we'll still continue to educate them.
Vaccines have provided an extra layer of protection. It has been made available to the public, but there are challenges. Vaccine hesitancy is a major one.
When they take the jab, it gives them pains. So I am also scared. To be honest, because I don't know what drug it is, I won't take it. When I'm not well, I know I need painkiller. Then I will be okay. But once I am fine, I know I don't need any vaccine.
I've heard the virus is there. I heard the vaccine helps, so that's why I went for the vaccine. At first, I was afraid, but when others went for it, I also went for mine. I felt pains in the beginning.
No problem, Nako. Inuko no kwalo, inako aka ewo jami fem no ko. First, no kare no ne iagbo e. No ye fenya kwa. Nya fane, iagbo no ye fenya agbo.
Some of my friends complained when they took the vaccine. They were told to take medicine. The pains continued, so I got afraid.
When I first heard it, I went for the vaccine. Nothing happened to me. Those afraid should go and take the vaccine. Nothing will happen to them.
According to Ashedu Keteke Sub-Metro, more women are getting inoculated as against men. Health Director for the area, Dr. Jacqueline Anita Soa, says the service will in the coming days implement fresh measures to increase interest in the vaccination exercise, including education and mobilization of the vaccination centers.
Since the vaccination started, there's even been studies on women who they tested on, and most of them even got pregnant after they've been vaccinated. So when it comes to the fertility part, there's really no correlation with the vaccine and infertility, for that matter. Okay, some people also, like you said, will say that when you take it, you become impotent. It's not true. And most of their fears or worries are not true. Most of them are baseless, if I may say. My boss says, as Greater Accra Region and National, we've been having training programs and workshops on vaccine hesitancy, which very soon we'll be rolling out the program in this sub-metro, God willing, very soon. We'll educate the community on their fears. We'll ask them questions for us to also answer and let them know. We'll actually address their fears. Let me say that. We are also doing more announcements, more sensitization going on. We need to get people vaccinated. It's very, very, very important.
Michael Papani, Ashali's report for JoyNews.
That's the situation here at Bukum, and when my colleague Michael Papani Ashali visited the area, that's the interaction he had. But let's have a wider conversation on this particular issue, vaccine hesitancy and misconception. The worrying situation we heard about yesterday from Dr. Amponsah-Achiano, that in the Volta region, loads of the vials had to go waste because of vaccine hesitancy and misconception. I've been joined via Zoom this afternoon by Director of Health Promotion and leader of Ghana's COVID-19 Risk Communications team, Dr. Da Costa Boaje. I also have on the phone the Deputy Volta Regional Director in charge of Health, Dr. Senanu Jokoto, joining me as well. Also, we have the Greater Accra Regional Director, and then also from the Upper West Region, Dr. Damien Pungiri is the Regional Health Director. Welcome, gentlemen, and thank you very much for your time here on The Pulse. Can you hear me, gentlemen?
Thank you, MFA.
Thank you, MFA.
Yeah, I was hoping I'll get a female representation as well, but I'll take further on later on that. But Dr. Da Costa Boaje, I would want to start with you first. If there are any hints on fellow Ghanaians tonight?
Thank you, MFA. I think the measures that we have taken, especially the airport, will certainly not escape. Then maybe the compulsory vaccination in country from January. So I think I've given you enough.
I know, but there will be no lockdowns, will there?
I don't think so.
Okay. Well, thank you for that hint there. But more worrying and importantly is the issue about vaccine hesitancy and then misconception. I'd want to start from the Volta region because yesterday Dr. Amponsah-Achiano raised the concern about the number of vaccines that had to go waste because people were hesitant, and then the issues about misconception and superstition. Dr. Senanu Jokoto joins us from the Volta region. Doc, paints the picture to us about how serious the situation is in the Volta region.
Thank you very much, MFA. So we have a mandate to vaccinate as many as 1,055,000 people. So far, only 176,000 people have taken their first dose, and only 55,000 people have taken 2 doses. And in terms of percentage, that is only 4.5%. And we all know the implications of not getting vaccinated. We are exposed to further risk, especially those who are vulnerable. When our most difficult situations that we have faced, when we enter some of the communities, clearly, some would even begin to sing and chant that they are not going to take the vaccinations. And if we look at the projections that we make for the deployment of vaccines every week, we are looking at 20,000 during normal times. And then when we are running a full...
Okay, it appears you've just gone mute there, Dr. Jokoto. If you can work on that for me briefly, because that's a very important point you're making there. Dr. Jokoto, can you hear me now?
I can hear you clearly.
Okay, so the issues about the chants against the vaccine, you can go on.
Yes, the chants against the vaccines sometimes, and then if you look at the number of people that we have to vaccinate within a week, we're looking at about 20,000 people at least. But when we go into campaign mode, we are looking at vaccinating about 40,000. 40,000 times 4 will be 160,000 doses. But sometimes you're not even able to do half of that. So that's a clear indication that there is pronounced vaccine hesitancy in the Volta region. What is interesting is that even for some people who have taken their first dose, when it is time for them to take their second dose, nothing compels them. You call them to come and take their second dose, and they'll be given excuses. And what has been very common, especially those who live along the borders, some of them needed the vaccine cards to be able to cross into Togo. Because when you get to Togo, the gendarmes there are going to ask you for your vaccination card before they let you in. But on the Ghana side, presumably the borders are closed. So there's no such interaction. But those who manage to meander their way into Togo, they ask them for the card. Now, because the Togo side are no more asking for evidence of second dose, nothing is compelling them to come and take the second dose.
Okay.
But when they take a shot to get a card, they took a shot so that they can get into Togo. So definitely, I think the vaccine mandate in Togo even played a role in those living along the borders taking the vaccines. What has also affected us would be some prominent people also not taking the vaccine, and some of them speaking against the vaccine. And although we've had so many people who are spoken for the vaccine, any time you have somebody coming out speaking against the vaccine, that is a major event that derails the campaign.
Okay. Well, let's not give it all away just yet, Dr. Jokoto. I wanted to make a quick round on this. Let's compare your situation in the Volta region to that of the Upper West region. These are the two most important regions for me personally, so I'm very interested in what happens there. But I must say that those watching us live on Facebook and YouTube is a good opportunity to also put out your questions, your comments, your suggestions, so that we can put them across to my guests also this afternoon on the polls. So, Dr. Punyuri, what's the situation in your region? Are you also facing such challenges as Dr. Jokoto has painted to us?
Thank you very much, MFA. For the Upper West region, we are not facing such a serious hesitancy. Initially, these misconceptions were there. People felt that when they took the vaccine, they were weak. We didn't really, when the vaccines were not really available, we didn't really bother so much. And now that we have the vaccines and many other factors, for example, when we started rolling out the vaccine, we extended it to the media, the traditional authorities. And quite significantly, the National Catholic Bishops' Conference was organized in this region with a massive call on the people of Ghanaians to go out all there for the vaccine. So all these factors may have contributed to quite a good uptake of the vaccine in the region. Currently, we have covered at least 30% of the population have received at least a dose of the vaccine.
Okay.
And so we have, in the next 2-3 days, we may even be calling for more vaccines.
Do you have the figures of the breakdown of this 30% at least? We know for the Volta region, 555,000 have both taken the 2 doses, over 7,000 single dose. Do we have the breakdown of the figures for the Upper West region, for instance?
So for the Upper West region, we are looking at a total of 57,000 persons that we are supposed to vaccinate by the end of the exercise.
Okay.
Currently, we are dealing with roughly about 200,000 persons who have received at least a dose of any of the vaccines, and then around 45,000 have received full dose.
Okay.
Full coverage. That means they have either received the 2 doses of AstraZeneca or 1 dose of Johnson & Johnson. So that is the breakdown of the situation in the Upper West region.
Well, it appears it's a smooth sailing for you as compared to the challenges being faced by Dr. Jokoto in the Volta region. But Dr. Da Costa Boaji, you are in charge of risk communication. What does it tell you? We will take the situation in the central region shortly, but listening to the Volta regional situation and the Upper West situation, what does it tell you about the communication that you have to do in terms of risk management?
Okay, thank you so much, MFA, and thanks to the 2 directors who have spoken. In fact, for us, we will continue to provide support to the Volta region and all the other regions to make sure that uptake is increased. We've been working very closely, so we are updated with the situation. But let me put something into context about what Dr. Chianu said. See, what happened was, earlier on, we were receiving vaccines near expiring dates. That is the ones we received. But because of our effective immunization system, we are able to obviously deploy once we get it. So those are some of the vaccines that are going out of there. So the ones we have now do have a longer expiry date. So we will be, though there will be wastage, let me put that in, there will be wastage from the previous ones. We do have ones with longer expiry dates. Now, for the Volta region, it seems there is a peculiar problem that we really have to support them in. But our approach has always been that we take the vaccines to the people in churches, in sports stadia, in places where people gather. So we will be working with Dr. Jokoto and team to make sure that we intensify this. Now, since we declared the month of December as the vaccination week, vaccination month, we had two phases. So the first phase was where we make sure that all our health facilities do have the vaccines. Then our mobile teams also going around to the various transport stations and others, as I've talked about. Now we'll be moving into a campaign mode, and it will be very soon. Once we move into the campaign mode, then this is where we will use the mostly above the line communication to obviously support the social mobilization activity. I must say that before around 30th November, when we declared the vaccination, the number of jabs that we had given at the time was around 5,000. But as we speak, it's increased to about 7,500. But I mean, obviously, because we've not made that public. As of the 14th, we had, I mean, these are the official figures. As of the 14th, that is what is in the public domain. It's around 6,400 million.
Yeah.
Yes. So for this reason, it shows you that between the time that we declared the time we declared as vaccination month till now, a number of jabs has actually gone on people's arms, which is good. So it means uptake is increasing, but we still have the challenge of these hesitancy in some of the regions. So we'll continue to work on, but we are pleading with the Ghanaian population to support us in this, because we are all not safe until everyone is vaccinated. It is very important. And come January, should you not do this, you will not be able to get to certain places, certain public places.
Okay.
And I must be honest, we are working on the EI that will mandate us to do that. So we don't have any problem about that.
Well, we'll come to the vaccine mandate shortly, Dr. Da Costa Boaji. I must say this is more like the proofs abridged version here on the polls. But Dr. Jokoto, is one thing I would want you to chew on whilst I go to the central region. What are some of the issues or the concerns that you've heard that shocked you the most when it comes to vaccine taking, amongst others, in the Volta region especially? I would want to know. But whilst you chew on that, let me go quickly to the central region and join our correspondent, Richard Kujonyako. He's also been monitoring the situation, so we get a reporter's perspective also on what is happening elsewhere in the central region. Richard, you have been monitoring the situation since December was declared a vaccine month. What have we noticed, and what are authorities telling you about vaccine hesitancy and the misconceptions?
Well, so far, the Ghana Health Service tells us, in the central region, tells us that they vaccinated more than 400,000 residents in the central region, and they are seeking to vaccinate more because they have a target, because you know that December was declared as a vaccination month for the COVID-19, and so they are doing a lot. But they also face some vaccination hesitancy because some communities, they went, did not, a lot of them did not want to be vaccinated. They cited religious beliefs. They also cited that, well, they feared that something might happen to them. And they've also heard that people have had reactions after taking the vaccine, and so they fear that should they also take the vaccines, they would also have similar reactions or more than what the other people reacted to. But again, the service tells us that they are increasing education and sensitization. Now, they are opening the scope too wide to include the religious leaders and then traditional authorities as well. So when you go to the churches and the mosque, some of the education have been given to the heads of the religious bodies. And so they've been educating their congregants to take the vaccines. In fact, they have now even been sending the vaccines to the churches, to the mosques, to the schools and other things. So they are hopeful that such people that have some doubts and do not want to be vaccinated, they would get them in the net. So by the time December is through, they would have vaccinated or they would have reached their target. And so that is what I have seen from the central region.
Okay, but in your personal interaction with residents, for instance, friends, family, amongst others, do they have concerns that maybe we can put out to those our doctors and Dr. Abuaje there on the line with us? Are there particular concerns they've raised about taking the vaccine?
Well, there are not much concerns except that the immediate reactions people get. And so they said that they need to eat heavily before taking the vaccines, or they need to take some painkillers before. So when others that have taken these vaccines tell them that, some of them get scared because they do not know whether they have some weaknesses that taking the vaccine would automatically increase that kind of situation for them. But that is really, but aside that, some others were even looking for places to get vaccinated because they know that with some time to come, if they don't get the vaccines, they might not be able to get access to some public spaces and other services as well. And so with the central region, generally, it's okay, with the exception of the few hiccups that they experienced earlier.
Okay, so thank you very much, Richard Kujonyako. Well, from the three regions that we've been assessing so far, it appears that the Volta region needs a lot more attention. There are some parts of the Greater Accra region also that we visited that also needs a lot of attention. Issues about accessibility is what I've also picked up from the Central region from my colleague. We'll talk about that as well, gentlemen. But Dr. Jokoto, I was asking you about what you've heard in terms of the misconception and the hesitancy that shocked you the most when it comes to taking the COVID-19 vaccines.
All right, thank you very much, MFR. Before I get there, I would like to say that close to 240,000 doses have been given in the Volta region.
Okay.
So that is an indication that some people are ready to take the vaccine, and we thank them. We thank all the stakeholders who have contributed to it. But what is most shocking, several of them, but let me just mention three. Some will tell you that actually COVID-19 does not exist. It is just a machination by a certain group of people to make money. And in order to make more money, they've added a vaccination intervention to it. So they are not going to even take it. Some also think that if they take it, it's going to make them infertile. So there's no way the youthful population, the women in their fertility age, they are not ready to take the vaccination. There was an occasion where one of such women went to take the vaccination, and then she consented. She was spoken to by the health workers. And after that, the husband was so furious and almost came to assault the health workers for vaccinating the wife. And then for some of them, they also believe that it is a scheme to deplete the population of the Volta region for some parochial interest. So numerous conspiracy theories. But like I said, the silver lining in the cloud, in the dark cloud, is that people are beginning to accept it. So when we get more support and when we continue to work hard, just like all the health workers and the stakeholders have been doing, we will be able to surmount some of these challenges. Okay. Education actually works.
Well, but briefly, before I go to Dr. Ponyuri, for instance, with this 240,000 doses that you've been able to administer in the Volta region, you've mentioned earlier also that 555,000, they've taken both doses in the region. How did you do it in spite of all the challenges so that there will be some key learnings that we can take from there to some other regions as well?
So let me clarify the figures. So 180,000 have taken the first dose.
Okay.
55,000 have taken 2 doses. So that makes it a total of 230,000 doses that have been given.
Thank you for
and
that.
Our target is 1,055,000. That's the number of people that we have to vaccinate. So far, we have used key stakeholders in this campaign. For most of the traditional areas, their chiefs are more or less the key advocates for us. They are the champions of COVID-19 vaccination. And even within the region, the president of the House of Chiefs, Togbi Teprehodo, himself took the vaccine, the full glare of the public, before the media during one of the regional House of Chiefs meetings, and that helped a lot.
Did you have to compel him to do it? Did you have to compel, coerce, whatever?
He was so great. He did so well, and let me, on behalf of the regional directorate, thank him, because he was actually the one who called that he was going to have a meeting with his paramountcies, and that he would want the health directorate to come and speak about vaccination, and if possible, vaccinate them. And when we went, they were all ready to take the vaccines.
That's my chief, by the way. I must declare, and that's my chief as well. So that's fine. But let's go to Dr. Da Costa Boaje. So this is the situation that we are facing, at least regional chiefs. We are getting religious bodies as well joining in the Volta region to ramp up support for the vaccination. But elsewhere also, we are hearing some religious leaders, some chiefs, and then we're hearing about CSOs now coming up, amongst others, raising and fighting this particular campaign that we are on, especially the vaccine mandate that we're going to embark on in January. There are various concerns that have been raised. How are we hoping to ramp up support for it when we have all these advocates speaking up against it?
Thank you so much. But let me commend Dr. Jokoto for the work that he and the team are doing in the Volta region. Clearly, you heard some of the risk communication strategies that they've employed in the Volta region to enhance uptake, which is very good. And I will encourage him to continue with that, because it will work. Even though the challenges are there, but it's the education that we give to the population that will determine the uptake and the social mobilization activities that we do. So they are doing well and they should continue, but we will link up with them with some of the specific that he has actually given, like people talking about fertility, talking about the disease non-existence, and the others. So we will link up and make sure that they get the necessary support to make sure that they enhance uptake. Now, on the mandates, MFR, let me say that at the Kotoka International Airport, yes, we have started what we said we were going to do. It started yesterday. And I must say that I've heard a lot of concerns about people saying that we do not have the right to do that, they have the right. But the fact of the matter is that we are in a pandemic, and the Constitution even gives room for crisis, what you should do. And in this case, I must say that the minister is right by saying that the Public Health Act 851, that is the Public Health Act 2012-851, actually works very well. Section 26 is clear. That is what we've done. Section 26 gives us, the public vaccinator, the mandate to vaccinate anyone who is coming in our country with a disease that we presume that will be affecting the rest of the 30 million.
But the argument that we've heard them make is that is this a crisis situation? Looking at the number of deaths we've recorded as against what we are seeing with malaria and other sicknesses, they say this is not a national crisis per se, for which reason we have to trigger that portion of the act.
We are in a pandemic, MFA. We are in the pandemic. So we are not out of the pandemic until the WHO comes to tell us that we are out of the pandemic. We are in a pandemic. And like I'm saying, the act is clear. The 851 and section 26, examination and vaccination at the point of entry. It says that a public vaccinator may examine and vaccinate a person who arrives in the country but cannot produce satisfactory evidence of successful vaccination. That is what we have used now. Now, that is for the port. The in-country one, which will come into force in January, we know that we need the EI. So we are working on that. We are not there yet. At the moment, it is just an appeal that we are appealing to people to go for their vaccination. And we have declared our intent. So this is why we issue the alerts. So we have declared our intention that should you not take advantage of the situation this December, in January, you will be refused entry in some public places, including workplaces.
Okay. Dr. Apunyuri, so we've heard about some religious bodies and traditional authorities, some of them helping in the Volta region. Is it the case in your region as well, such that you've had this 30% uptake when it comes to vaccination? Are you ramping support from traditional authorities and religious authorities, or do you have them also speaking up against it?
Well, MFA, currently in the region, so far we haven't really come across someone who is speaking up against the vaccination. On the contrary, what we have is that we have the various religious groups, the regional chief imam, the overlord of the Wala Traditional Council, and all the paramount chiefs. There are so many paramounts in the region. The paramount chiefs are all in support of this vaccination, and they were the first group of people who joined the health workers in this vaccination. And I believe that that might have helped in the regional awareness. There are focal areas where people, try to resist. But then usually based on misconception. For example, we picked leads that one community were not vaccinating because they felt that someone had died after the person took the vaccine. But this was the person took the vaccine more than 2 weeks before the incident. And so when the team went there and did all the investigation, they realized that the death really had nothing to do with the vaccine. And then they educated the people, and the people started taking the vaccine. So usually we are still on the ground. Anytime there is hesitancy based on any issue, we try to get there and address. And I believe that we have a long-standing working relationship with the communities. They are part of the health service delivery, like the community health committee members. And all these groups are very key in helping us overcome any resistance to vaccination. So this is what is happening in the region. We are yet to identify any person or group of persons who are actively campaigning against the vaccination.
Yours is a smooth sailing then, but really the misconceptions that we've heard, the shocking ones and not so shocking ones, the impotence, infertility, you would die, amongst others, really. Let's have a frank talk, Dr. Jokoto. Where would it be stemming from? There are those who say there's no smoke without fire. Is it not the case that there may have been instances where people have taken it and really have become impotent? Be frank with us. We are all listening. Where would it be coming from? Don't we have cases like that?
I'll be very, very frank with you that for all those who have taken the vaccines in the Volta region, like I mentioned, about 240,000 doses given, we have not had any case of any infertility reported to us. We've not had any case of impotence. We've not had any case of a vaccine being linked to any mortality within the region. But I can tell you where it's coming from. It's coming from the global anti-vaccination campaigners, because they share some of the videos with you on social media. Oh, doctor, you said this the last time you came here, but listen, this is what we just found on the net. And sometimes you check and it's fake, completely untrue. So some of these things are feeding some of their insecurity. So it's making it difficult. So every single day, you have a new issue to address with regards to vaccine hesitancy within the region. And the latest one that people are talking about is that, well, whether you take the vaccine or not, you are still subject to the effects of the virus. Mm-hmm. You can still get COVID-19. You can still die from COVID-19. So
yes, because we've seen people who have been fully vaccinated, yet they've still contracted the virus. So people then say that, then what's the use of getting the vaccine anyway?
Good. So that would be inaccurate analysis. The analysis that people ought to do is, first of all, how many people have taken the vaccines as compared to those who have not taken the vaccines? Then you compare the amongst those who have taken the vaccines, how many get COVID? Among those who have not taken it, how many do get COVID? And you realize clearly that among those who have taken.
Did I lose you, Dr. Jokoto? Dr. Dacosta Boaji, okay. It looks like I lost Dr. Jokoto there. But Dr. Dacosta Boaji and Dr. Punyiri, I'm sure you can add to this issue about where this misconception is stemming from. Dr. Boaji, you deal directly with government. Is it that somebody somewhere is paying you to forcefully give us these vaccines, knowing the danger it poses to us?
Thank you, MFA. I think Dr. Jokoto is right. So what have we been doing as the Ghana Health Service? So we have set up a misinformation task force with a misinformation dashboard that we are able to monitor, scan the media, social media, and other places to look at what is going on. And we have been successful in recruiting some of those anti-vax people to be ambassadors of this vaccine campaign.
Really?
So it is really the case that we just have to continue what we are doing. But let me also say this. You see, the vaccination is in the national interest. So this is when I will implore our politicians to be careful on statements that they make. Because, you see, they have a lot of followers. And, for example, if something that is in the national interest, we should all come together to support it. Because at the end of the day, COVID will not spare NDC, nor MPP, nor CPP, nor anyone. It is no respecter of person. So if we are doing something in the national interest and you see some group saying all sort of things, that feeds into the hesitancy. So my point is we will plead with every Ghanaian to support us in this exercise. It is in the national interest. One, it will help us to get our economy back. It will help us to have our social life back. It will help us to be, obviously, enjoy our lives. We all don't want these restrictions, but we have no choice than to do it, to make sure that we protect every Ghanaian. So that is what I'll say for now.
I was asking if, one of the misconceptions we've heard is that there's some government somewhere that is paying you so much for you to inflict this upon us. Is that the case?
No, it is not. It's complete falsehood. There is no government paying us anywhere to obviously do anything.
Okay. Dr. Punyiri, so the issue also about accessibility is key. You may be making giant strides, 30%. We are hoping to get 100%. How accessible are these vaccines to the people in your region? And Dr. Jokoto, if I have him back also, we'll get to him on that as well. But Dr. Punyiri, how accessible is it?
Well, currently, the vaccines are being administered in every district and then the communities. What is happening is that in some of the communities, especially the eastern part, this is their major harvesting season because of threats of bushfires. The uptake there is a bit slow, so we may not be able to cover majority of those people. But we're anticipating that January, when they will have finished with their harvest, and then come back home or come closer to their communities, then we can get them and do the vaccination. But in terms of access, every district, every sub-district, the vaccines are being administered. And as Dr. Da Costa mentioned, we are going to move into a campaign mode. And in a campaign mode, we don't sit at one place. This time, we may be moving from community to community, house to house, try to reach out to those who are yet to get their vaccine, using all, varieties of media to reach the people. So these are the things that we are going to be able to do to get a lot more of our people getting access to the vaccine. Thank you.
Well, but Dr. Jokoto, you may want people to partake in it, but could it also not be the case that the vaccines are simply not accessible to them?
Well, in the beginning, when we had not gone into campaign mode, we were just stationed in health facilities, so we had static clinics. But when we got a feedback that it was not very convenient to our people, what we now decided to do was to arrange with communities, go to them one after the other. A day before we go, we announce it on the community information centers. And then afterwards, we also go to churches, we go to mosques where they have festivals, where they have funerals. We take the advantage of every single gathering to be able to deliver the vaccine doses. We've also had teams going from house to house. We've had occasions where we announced the entire committee for people to come out at Deba. We talked to them and vaccinated. They didn't come out. But subsequently, when we began going house to house and explaining to the people how we had to do the vaccination, we had some appreciable intake, although it was still below our expectation. So we are using every strategy possible.
Okay.
And for the youth who love music so much, we have one local artist who also has a song that more or less campaigns against the vaccine. Although it was that was not his aim, but the lyrics perfectly fits the current situation of rejecting vaccines. So we've gone ahead to engage him. He has quite a good following, and we've agreed that we are going to have a new rendition of that particular music, so that he would also have the chance to clarify to his followers, especially the youth, who have been singing his song as an inspiration to reject the vaccine.
But this particular musician we talk about, has he taken the vaccine or he hasn't at all from your checks?
Well, he has not disclosed whether he is taking the vaccine or not, but I think it would be interesting to get that from him. And let me thank Ghana Health Service, the headquarters, Dr. Patrick Kumar-Boaji, Dr. Achianu, Dr. Da Costa. They have been extremely supportive of the Volta region, and we know that we are in it together with them. And going forward, we should be able to reach our targets.
Okay, and you're sure, since you are in charge, but I'm sure you've been frank with us all through, is it the case that, because you talked about misconception that people are thinking that it's a way of wiping out the Volta region of a sort and all that, is it the case? Is there anyone pushing you to do anything like that?
That would be against my ethics. I swore an oath as a health worker, and I'm going to stand by it till I die. So nobody can push me around to do anything to satisfy his or her interest. It's not going to happen. So it is in the interest of the health of the people. That is why we get up every day to go to work and ensure that they get the best of services in the Volta region.
Well, I needed them to hear it from you because they're all watching. But one grouping in this country that has the largest following will be the Christians, or the Christian Council. And thankfully, we've been joined on the via Zoom or via phone also by the General Secretary of the Christian Council of Ghana, Reverend Dr. Cyril Fayose. I'm sure his input at this point will also help the conversation to dispel the issues about these misconceptions and or the hesitancy. Reverend Dr. Cyril Fayose, thank you very much for joining us here on the polls this afternoon. So when it comes to hesitancy and misconception, would you say that the Christian Council, some of your members, have contributed?
I will doubt that very much. First of all, thank you very much for having me, and a very good afternoon to your listeners and viewers. I would doubt it very much if the members of the Christian community generally, not only the Christian Council, all the ecumenical bodies contributed in any way to this. There are still some conspirators or conspiracy theories out there who may be Christian. But by and large, for the Christian community, we have worked very, very closely with the COVID-19 team right from the very beginning. During the lockdown, we helped with the distribution of relief items. And then with vaccination, we educated our members on it. We were one of the first to be vaccinated at our offices. The vaccination teams actually came to our offices, and all our leaders took the vaccine, took the shot, and it was publicized in the media, on radio and TV. So we are all for it. We believe that it's for a good cause. It is going to save lives. And so we want to encourage all our members to take it. Okay. In fact, recently we also had another call from the COVID-19 team to help with the vaccination in the community. So they use our congregations, our places of worship, as vaccination centers.
Okay.
And we work again closely with our churches. We send a message down. So congregations, on their own accord, contacted the district officers of the Ministry of Health. They brought them in and they vaccinated the members of that congregation and the community in the neighborhood. So we are doing our very best. We are all for it. We think it is a way of saving lives. So all Christians, all members of our community should go ahead and get vaccinated. Yeah.
Well, Dr. Fayose, in my interactions on COVID since it broke in Ghana, the issue I've heard the most is about some Christians saying that this is a sign of the end time. It is the 666 era that we are in. Once you take the vaccine, they are able to monitor you. Is the Antichrist that is here through this particular COVID and the vaccination. Is that the case?
Is that what?
Is that the case?
No. If that were to be the case, most of us in Christian leaders in Ghana would not have taken the shot. When I say Christian leaders have taken the shot, I mean all of them. The Catholic bishops, the Christian Council, the Ghana Pentecostal and Charismatic Council, National Association of Christian Charismatic Churches, Council of African Independent Churches, and so on and so forth. All the bodies have literally gone ahead to take the vaccine. I think the text from Scripture is sometimes applied wrongly, sometimes misapplied when it is used as a reference point for some of these conspiracy theories. Again, that is not the real true interpretation of that portion of Revelation that is often quoted. So we don't support that position. So
this is not evil at all. It's not.
No.
Okay.
We have supported a campaign and advocated for the use of vaccination to cure the 6 killer diseases, to get rid of the 6 killer diseases in most of our society. And so we believe that this is just a continuation of that. It is scientifically proven that vaccination can help build our immune against some of the viruses and diseases that attack us. So that is our position.
Okay. Reverend Dr. Silver Fayose, we are grateful. But just before I let you off, is the church or the Christian Council still helping to ramp up support? Because we had a target of 20 million by the end of this year. It doesn't look like we've crossed the half mark for that target. But we are hearing about a mandatory vaccination, which will start in January. Is it something that the council, the Christians are also for? Because we've heard Advocates for Christ is a civil society organization that are raising concerns about forcing people to take the vaccines.
Yeah, at this point, we have not reached any consensus for or against the mandatory vaccination, but we are still ramping up support for vaccination and the use of our congregations, our places of worship as vaccination centers. So we are putting our members, our pastors in the local congregations in touch with their district health officers so that they can invite them to do the vaccination on their premises.
Okay.
So we are still doing that.
Okay, but would you rather the authorities do their work in terms of speaking to people and making them understand that they need to be vaccinated rather than forcing them to vaccinate?
Yeah, I think for lack of understanding, people perish. So when people understand, it is easier to achieve the purpose. But if people fail to understand, and then force is applied, sometimes people will still go underground. So sometimes people will still go underground and still try to evade the vaccination anyway, try to avoid it through whatever means possible.
Okay.
So I think we should, as much as possible, go in for education, helping the citizenry to understand and come willingly for the vaccination. Okay. And I think we will get there.
Okay. Thank you very much, Reverend Dr. Cyril Fayose, General Secretary, Christian Council. We're indeed grateful. Dr. Puyuri, Dr. Jokoto, and Dr. Da Costa Abuaji, I'm sure this is refreshing to hear that the Christian Council are with you on this. Any of you can take it at this point. Dr. Jokoto?
So for me, I think I am excited about all the discussions that we've had today, the support that has been given to us from the Christian Council, our regional directors, the CSOs, the NGOs, the media, and we just have to continue because our behavior this December will determine whether we will have a fourth wave or not. And it is important for us to take the right decisions. That is why we are going all out with our strategies to make sure that we avert any possible fourth wave. So the support is massive, and we want everyone to continue supporting us. We will also continue with our stakeholder engagement programs, which is key to our success in this, so that collectively we will achieve. Thank you.
Okay, so my cry has been heard. My producers have now given me some females to join in our discussion this afternoon. So we've been joined on the vast Zoom also by the Deputy Director of Public Health, Greater Accra, Dr. Akosua AEC. Welcome. We also have Dr. Priscilla Olings-Kpodo. She's a physician specialist and she holds a master's in public health and a fellow of the West African College of Physicians. She leads the social justice, the forum that Dr. Achiano spoke on yesterday. Welcome, ladies, to the show also. Your colleagues, Dr. Jokoto and Dr. Ponyuri and Dr. Da Costa Abuaji are with us also. We've been talking about the vaccine hesitancy as well as the misconceptions when it comes to vaccination. Dr. Akosua AEC, let me find out from you the situation in the Greater Accra region. We visited Bukum, one area, and it was high in terms of the hesitancy. Largely, what's the situation? He's the Deputy Director. What's the situation, you would say?
Thank you very much, and a good afternoon to all your listeners. So within Greater Accra, you would say that the hesitancy is not the same across You know, hesitancy is very area specific and location specific. So yes, I'm sure you've visited home and seen the challenges we are having. It's dependent. In some districts, they are very high uptake. So if you take somewhere like Koleklote, Ayawaso West districts, we have such a very good patronage and a high uptake. Then in some districts too, we are having quite some extent of hesitancy. And hesitancy, it comes across from different areas. People have their fears and they are worried about its effects upon them, what they have heard on social media and other things. All these things are influencing it, but a lot of engagement is going on. We are using key stakeholders within the various communities. So if you take Bukom, for instance, we have people within the assemblymen, some recognized family heads, and then youth leadership that are helping us to reach out to their own colleagues and friends, and then explain, understand first their concerns and their fears, and then explain and try to address those concerns to be able to win them over. So far in Accra, out of an eligible population of 2.8 million, we have 1.7 million people vaccinated so far. And with a coverage of about, that puts us at a coverage of about 55%. Okay. So we've come a long way. And we, in this month of vaccination, we are saying that we are kicking COVID out of Accra, and this is Accra's shot. So everybody needs to get a shot. Okay. And we are hoping that everyone comes out. Vaccines are available everywhere in all public health facilities. So that is our flagship logo for the season that we've just projected. Thank you very much. We are saying everyone needs to come out, get vaccinated, visit any public health facility. Beyond that, there are mobile teams going around to churches, to schools, to reach the 15-year-olds and above. And we encourage every family member to ensure that their own relatives are vaccinated, because, you know, it starts at home. If every house gets vaccinated, it means that the entire community will be vaccinated and the entire region will also be vaccinated. So we are encouraging every family head to ensure that every family member gets vaccinated. That way we can all achieve our targets. Thank you, and over.
Well, Doctor, you see, briefly, I would want a clarification on this. The 1.7 million, they've all taken both doses, you'd say?
So for the 1.7 million, they have received at least a dose of a COVID vaccine, and then 20% of that are fully vaccinated.
Okay. Well, the Greater Accra looks like they have a campaign going on. Maybe Dr. Jokoto and Dr. Ponyuri will also take a look at it. This is for the Christmas season, and also December. That's on your screen. Get vaccinated, and that's in the Greater Accra region. Dr. Priscilla Owens with the CSJ also joins us. You have been doing a lot of work. It's the forum that you organized yesterday that brought to the fore that Volta region, there are concerns there. They need help when it comes to vaccination. Please tell us your own, learnings, key learnings when it comes to the vaccination across the country. I'm sure you have a better picture. You have to unmute. Yes,
it's
good.
Nice seeing you again.
Good to see you.
Yeah. So it's been a journey really from March 2020 when we started seeing the first cases, and we have been on the ground as well, apart from following up on a lot of advocacy and other activities to help disseminate information as well as support government efforts. And yesterday's leadership dialogue was really informative, as we had a lot of insight into what's going on, not only from the Ghana Health Service, but also from the private sector, where NAHO, for instance, is playing a vital role in helping to support the fight against COVID-19. We did also come to terms with the fact that even though we haven't seen the high numbers yet, we've started to see surges. And if you're in the meeting, you'll recall that Dr. Chianu showed some graphical representation of the various waves that we've had, and you'd see that prior to the major waves, there's always that tiny hike, and so he even believes that we've had more than 3 waves, except that. So as to whether we're going to have the full-blown wave that we can call for the 4th wave, it all, like Dr. Acosta said, depends on how we behave, especially as we go into the festive season, because you're going to have generally the Christian religion or Christians, especially during Christmas period, would have a lot of church meetings, which require people to be in person, large crowds. And then, of course, people, I always say that we are hedonistic, and so would want to have a little bit of fun. And so you have people going into all sorts of places who wanting to feel free. And like has been discussed here, we definitely want to get back our lives, back to normal things. Wearing the mask, it's not as convenient, but if we have to get to that point, we definitely need to make commitments and sacrifices. Yes, there are questions, and I'm glad that conversations like vaccine hesitancy has come up, where we recognize that people who haven't taken the vaccine are not necessarily refusing it, but they have questions and they would need to be supported. And so education has to be beefed up, especially in places where we're seeing that the hesitancy levels are high. And of course, you have a lot of health workers who are ready to support. I know that generally people have gotten tired talking about the same things, but this is a time that we have to get up again and support education and the fight against the 4th wave that is coming. And so at this point, I'll also implore the Ghana Medical Association and other societies that have this at heart to join in the fight to prevent the 4th wave.
Okay, well, that's Dr. Kwedo there, and Dr. Senanu is still with us, is he? And then Dr. Punyuri, and then as well as Dr. Acosta Boaje. Dr. Senanu, you've heard your colleagues in the Greater Accra region, you've heard the CSJ also. It appears that we need to go down more to the people. Are there some key learnings also from your colleagues that you would want to take on and then also contribute to?
Definitely, this has been a very useful interaction. And I'm particularly excited because a lot of people watch your network here in the Volta region. So they are learning from other regions, the Upper West region, Greater Accra region, that there's nothing really wrong with getting vaccinated. This is going to be something that would encourage and inspire a lot of people to go and get vaccinated. For us as health workers, we know the risks involved in not getting vaccinated.
There. But I must say that those watching us live,
to ensure that we reach our target of having 1 million people vaccinated in the Volta region. And I'm sure with the support of all of you, we are certainly going to get it done. Especially you, MFA, this is your backyard. So we also expect to see a lot more of you in the Volta region assisting us with the campaign.
And once we are asking people to visit Volta, we need to also get them to vaccinate as well. It's a charge that we are all going to keep at this point. I'm sure Dr. Kwedo will also join us in doing that as well in the Volta region.
Yes, definitely.
Well, Dr. Kwedo, you're taking up that mandate as well?
I'm in.
By association, I'm sure.
We have a lot of champions.
Yeah, we're championing that. Well, Dr. Boaje, so the issue about campaigns also and the targets we set for ourselves, we had scientists mention that this was overly an ambitious target, 20 million by the end of this year. You haven't even done half of it. Looking back, should we have reviewed our target a bit more than to put it at 20 million? And how are we hoping that we can get up to that 20 million by the end of January now that you pushed it forward?
Thank you so much, MFA. So, you know, in public health, we set ambitious targets. So for me, the most important thing is, are the vaccines available?
Are they?
If the vaccines, I mean, of course they are available. Though they came in late, you all know about these supply chain challenges that we've talked about on so many occasions. Now, the fact is, if the vaccines are available and our immunization system is very strong to the district level, then it means that we have the capacity to do once the people are willing. So I still think that we have an opportunity to vaccinate the rest of the population by the end of the year, because in 2 weeks, we can do a lot as a service if you listen, if you hear from Dr. Jokoto, the Upper East, Greater Accra, Central Region, and all the other regions, you will see that they are capable of doing it. So the all society approach is what we need now. I'm happy you are joining the Volta region as an ambassador to support. I'm also happy the other colleague is also joining. So I think this is what we want. This is the spirit. This is the Ghana spirit that we need to make sure that the vaccination is actually a national exercise so that we get back our lives. But I still believe that we can achieve the 20 million population. As long as the vaccines are there, yes.
I must declare that I have been vaccinated and I'm still alive.
Excellent.
I am not infertile just yet. Maybe I have to check that. So I'm still alive as we speak. So we are expecting the president to address us tonight. Dr. Da Costa won't give too much away. But Dr. Jokoto, Dr. Punyuri, Dr. Isi, and then Dr. Kodo as well. Is there anything that you're looking forward to that the president will say that will clear this issue about hesitancy and misconception? No particular order. We can do this chaotic in any way.
I think the president's voice carries a lot of authority, and people hearing him speak about the vaccines will be very comforting. And a lot of people are also looking out for details when it comes to the vaccine mandate. We hope that the president would give us the rationale for the vaccine mandate. When people understand why the country has to go this way, it will be easier for them to accept it. So these are my two expectations that I'm looking forward to this night.
Okay, thank you very much, Dr. Jokoto. Dr. Kodo, you have anything to add?
Well, precisely what Dr. Jokoto said, and essentially what we are hoping for is that he throws a lot more light into the rationale for the vaccine mandate so that people understand that it is for the greater good. And we know that people have concerns, and also give us some details of what they intend to put into place so that as many as will need, the vaccines would go for it. And also because he said he definitely carries a lot of, his voice definitely carries a lot of weight, and it will reassure people to know that there are good plans that are meant to protect the public and not just to force people into things simply because somebody is giving us money or somebody is forcing us to have a lot of these things to address. Thank you.
Thank you. Dr. Isi, you have anything to add?
Yes, I think we are all very excited about the president coming up to give us some insights into the new approach in terms of the vaccination. I'm sure my regional director, Dr. Charity Sapon, is very excited about this. She's the one I'm representing on this issue because all throughout, especially the Accra, adherence to protocol always improves right after a fellow Ghanaian session by the president. And it's a key part because one of the key successes about our approach in terms of our response has been the strong political will, not just from the president alone, right down to the regional ministers, and then at the district level, led by the district and municipal chief executives as well. And they are actually the chairs of the public health emergency management committees at the various levels. So it adds to the response that extra touch that shows that the political aspect and the administrative arm of the entire country is supporting our response. And it really helps get the general public to comply with the directives and also understand better. So we are very happy that this is going to happen this evening. And I hope that Ghanaians will make time and listen despite all the activities going on, because usually it would happen on a Sunday. But I'm hopeful that we'll get good listenership and ensure that people also take to heart whatever he shares with us this evening. Thank
Definitely
you.
be live on all our platforms, so don't worry, you still get that full coverage. But just before I let you all off, maybe just one person can just tell us this. Is it okay for us to go back to our festivities and do all that we can, wearing our mask and all that? Is it okay? Would it not affect anything at all? Can we go back and party in December, dirty December, some people have described it. Is it okay to go back to it?
If I may come in here.
Yes, please, Dr. Punyere.
Yes. If you realize, I think last year around the same time, immediately after Christmas, there was a period that we had a huge spike. And then we had a lot of mortalities from that particular wave. And so we will expect that even if we are going to celebrate, the protocols say that we should do celebration in the open. You know, churches, when they are doing their open night, they do it in the open and provide airy atmosphere, environment for people to be able to do that. And then put on our mask. And so my expectation for the president, it's been some time now since he last addressed the country. And in addition to what my colleagues have said, we're expecting the president to also give guidance as to how we're going to celebrate the Christmas. In terms of protocol, adherence, etc. So this is something that I believe a lot of Ghanaians are waiting for.
Okay.
Thank you.
Thank you very much. For some reason, the three regions that were selected are the top three regions for me: the Volta region, the Upper West region, and the Greater Accra region. I'm sure my producer knows that. Thank you very much for joining us, ladies and gentlemen. Dr. Da Costa Boaje, lead for the Ghana's COVID-19 risk communication, among others. We also have Dr. Senanu Jokotos, the Deputy Volta Regional Health Director, also joining us. We have Dr. Damien Punyere. He's also the Deputy Director, Regional Director, Upper West Region, also joining us. We also had Dr. Akosia Sika AEC, she's also the Deputy Greater Accra Regional Director. And then we had Dr. Priscilla Olins-Bodo. She's the lead pillar also for CSJ. Many thanks for your company. I think I have my perfect guest for another COVID show on The Probe still to come. Thank you so much. I'm very grateful for your time. But let me take you to Germany, where COVID is also top of the agenda, and the country is beginning vaccination of children aged between 5 and 11 this week. DW correspondent Emmanuel Shays joins us with details. Well, Manuel, please give us an update on the situation in Germany now. It's interesting that you're vaccinating 5, amongst others. Tell us more.
Well, the situation is still quite dire here in Germany. We see the 7 days incidence rate decreasing. It was 432 for 100,000 inhabitants last week. Now it is at 375, but the figures are still very high. There's over 50,000 new cases registered on Tuesday and 453 additional deaths. On the vaccine front, Germany still falls short of having 70% of its population fully vaccinated. That's actually less than what former Chancellor Angela Merkel had expected. She had expected to reach 75% of the population fully vaccinated. And within the population, there are signs of fatigue as well for the situation. There's a fringe of the population, really a minority, that is taking to the streets to protest against the government's measures to curb infections. And those protests often turn into riots. But there's a majority of Germans, actually 60% of them, that think that the measures taken simply don't go far enough, and that's twice as much as they thought was the case in November. Overall, everywhere in Germany, there's a rule of either being vaccinated or recovered to access most places of work, most places of socialization. But yeah, there's a general sense of fatigue after nearly 2 years of pandemic.
Okay, that's interesting. So 5 to 11, that's what Germany has started this week to vaccinate these children. But this comes with specific recommendations, right? Tell us more about it.
Well, the vaccination of the youngest has begun earlier than planned. It's children aged 5 to 11, which will be allowed to get vaccinated this week. That's almost a month earlier than what is planned in Australia, with the Scientific Commission here in Germany advising children with a medical history, children at risk, to get vaccinated. And this will be a lower dose of the BioNTech Pfizer vaccine, given twice with an interval of 3 to 6 weeks. So that's a green light for children at risk, but all parents, all children are encouraged by the government to get vaccinated, and there's a very high demand on the parents' front as well.
So with that high incidence rate among children, Emmanuel, what else is being done to curb infections in school in particular? Ghana wants to learn.
Well, the number of infections is really high in schools, which is why there was so much anticipation for a vaccine available to the youngest. But on top of that vaccination campaign, there are also changes in the classroom being implemented. Air filters, mandatory mask wearing, to name a few. Online classes also replace in some cases in-presence courses, but there's still many issues for parents when children have to quarantine because there's a positive case in the classroom, and they have to stay at home, making the parents also having to organize childcare, and also it's difficult to ensure the continuity of learning when there's so many constant changes of settings. So there's still a long way to go out of this pandemic, and perhaps this is being felt the hardest by the youngest.
Thank you very much, Emmanuel, reporting from DW, giving us more insight into what Germany is doing. I'm sure it's been a lot of taking this afternoon here on The Pulse. When it comes to COVID-19 hesitancy and misconception, I'm sure we have cured that because, like I said, I have vaccinated and I am alive. Nothing has happened. You can do same as well.
What's up, guys? My name is Sammy Forson, host of the Weekend City Show and Ignition right here on Joy 99.7 FM. Well, anytime you happen to be busy and you miss out on your favorite shows right here on Joy FM, here's what you can do. Log on to myjoyonline.com/podcast. Just go on there and you'll find all your shows on demand 24/7. There you can catch up. Remember, Joy FM remains your radio for discerning listeners.
Joy 99.7.
And it's time for sports. No, I'm not the one presenting. It's Oreku Ampofo. He's with me here in the studio. Oreku, before we go for sports, I'm starting the mandate right here. Have you been vaccinated?
Yeah, 2 shots of AstraZeneca.
Okay, you are clear to do sports now. What do we have?
Thank you very much, MFR. So in sports, we have a wonderful feature with Benjamin Azamati, who's the national 100-meter record holder. Now, he says that he was tense prior to his race at the Olympic Games earlier this year. Having earned the title as Ghana's fastest man, Azamati was touted as one of the favorites to get Ghana a medal at the Games in Tokyo. However, the 23-year-old failed to make it past the heat after finishing 4th in Heat 7 behind Australia's Rohan Bowen, Johan Blake of Jamaica, and Great Britain's Chinju Uja. Now, Azamati has been speaking to my colleague George Addo Jr. in detail about his maiden Olympics appearance, World Championship, and life in Texas A&M.
So it feels good to be home, definitely. I've got the record holder, 100 meters, national record holder, 100 meters, Benjamin Azamati, joining us. And he's going to be telling us a whole lot. Azamati, how does it feel to be back home?
It feels good. I mean, I like the atmosphere, and a few friends welcomed me. My family called me and a whole lot. So it feels good to be back home.
And you cannot run away from what you know how to do. You are back home and you are the athletics oval. Yeah. So what's happening here? What are you telling the kids?
Yeah, so it's about a program that is happening in Kumasi.
Yeah.
So I'm actually coming. I actually came back because of the program. So I just came here to, I serve as a motivation for them. So just give them 1 or 2 few talks and then maybe correct some things that I know and all that there, just to help them.
Yeah, I know how the feeling is like. Azamati is modest, doesn't want to make it sound like, but you will start to these ones, and I'm sure the reaction that you saw yesterday was very, very important when you saw them. Now, I don't know, when you sit back and you look at your year that started with a lot of power from January through to March to April, down into the Olympics and out. I mean, what comes to mind? What goes through your mind when you look at your year, 2021?
Yeah, I mean, I feel it's been really a good season for me. I know for sure that it has not been my best season yet. I know there's more to come and all, but it has been a season of records. It's got to a time, every time I run, it has to be a record and all that. I'm proud of it, and I want to, move on with the same thing, the same standards for myself. Every time I run, I want records to be broken and all that. Of course, there are few records I didn't get that I'm looking at the next season. And also there are other set goals that I'm looking at the next season. There's Commonwealth Games coming up, there's World Championship coming up. I'm training, I'm practicing towards all those games, and I just don't want to go there to go represent. This time I want to go there, go get something, go get laurels. So that's basically what I'm thinking, and I'm actually working towards.
I mean, we go back to what's happening in Texas, and I'm just thinking. How are you coming to terms with it? Because you've taken the whole school by surprise. The last time, the commentator was Azamari, like a race car, the latest race car, Azamari. I mean, did you believe you could do that?
Yeah, it's all about determination. All the time I say, once you have the 3 Ds in life, you're good. You have to be determined, disciplined, and then dedicated. So once I have these 3 Ds, I'm good to go. I mean, it's not something that I didn't think I couldn't make it. No, I knew once I worked hard towards it, I'm gonna get it. So it coming, yes, some of them came as a surprise, but I knew what I would be able to do. I knew I am geared towards this, I can do this and all that. So most of them didn't come as a surprise to me, but of course there were 1 or 2 things like running the 9s, running the 20.13, they all came as a surprise to me, but yet I didn't doubt my qualities or my potential. So yeah, indeed, a lot of people have heard of my school because where my school is, Kenyan, Texas, a lot of people have not heard West Texas A&M, but because right now they have a guy that went to the Olympics, and they have people tweeting about him, they're all over Instagram and everything. So I think it really got the exposure, and I'm happy about it. I mean, a guy from Ghana, making a country, making a school in the US be that known. I mean, it's something to boast about. So I feel very honored, and I feel it's a good thing, and I feel I've really contributed to the school so far.
I just want you to take me through it. I mean, how is your everyday life like? I mean, when you're walking around the campus, I can imagine. I know you felt a different level of that here at the University of Ghana. There's a lot of nostalgia to walk out here and you see your Samba Hall and all your guys. But how is life like walking on the streets of
Texas? So it's first when I go back from the Olympics. I mean, you are going to class and people pointing fingers. This is the Olympian. I mean, you get professors, bragging, hey, I have an Olympian in my class, you understand? And that time, all the classes I've been to, like the teachers will let you stand up just to talk about the experience, because most of them have not really had the feel of seeing an Olympian or talking to an Olympian and all that. So I mean, it's good, and looking at them motivates me. Looking at all those things wants me to do more. We just don't have to call you an Olympian, but let's say a world championship, like medalist, you got a medal in this and all that. So that's the target for me next time. So looking at all these things, I would say basically they inspire me, then they help me to do more of that.
That is you soaking it in. How's your mom been soaking this in? At a point, I just feel like this may be too much for your mom to soak in. I mean, it's been such a roller coaster. I mean, how's she been coping?
Well, she's proud. She's proud. I mean, to have a son that is really doing good in the sports, that everybody's mentioning his name everywhere she goes, and I mean, these are things that they can also boast about. They have their child in the athletics field, that he's doing so well. So I think her prayers have come true. This is all she wanted. Hey, my child has to do good in the sport, and she did track too. So
wow, you didn't. I didn't know this. Now, how come you never told me this? Oh, your mom did track.
Yeah, she used to run 400 meters in SHS. So yeah, she did track, and she loves track. And so me coming out to be like, one of the good guys right now. I mean, it's something that she really likes and she's happy about.
Is she able to watch races live?
Yes, she watches races, and even Instagram live or Facebook live, wherever I have my interest, she's there. My dad is there. They want to, have the feel of their son talking and all that.
Okay.
That shows how proud they are.
I thought sometimes, sometimes mothers are a bit skeptic. They can't handle the emotions of seeing their son going through anything until what, and so they just like to go back. But it's good. I mean, how much in terms of help have your coaches up there done for you?
They've really done a fantastic job. I mean, obviously Ghana takes me to Olympics. They just buy a ticket for me, but we are talking about a school that pay for my rent, give me stipends to feed myself. If I get injured, they take care of me. Yes, I'm running for them and everything, but before the Olympics, after the season is over, your coach is not obligated to train you. He can go have fun with his family and all that, but like they took the chance to correct certain stuff about me, still sitting to train me for me to go to Olympics to represent my country, not theirs. They could have chosen not to, guide me and everything. You understand? But this time they chose to, be with me because of the love they have for me, because of the love they have for the sport. And not just that, maybe because of my personality also. So they've really done a good job. Like, there are people that love what I'm doing and they really appreciate whatever that I'm doing. And because of that, they want to go extra mile for me. So I'm really happy. I'm under them and they are, bringing me up.
Yeah, I can see that the America is also entering you small. It's okay. Yeah, the flapping here and there. It's okay. It's normal. It's okay. It's good. So, I mean, I think for you, and knowing you, I'm sure the Olympics played in your mind a lot.
Yes, it did. But to talk about the Olympics, I mean, it was the biggest stage I've ever gone to. Aside the World Championship, the World Championship was one that I didn't get the chance to run an individual race. At this time, I'm there running an individual race. But as a person representing West Texas A&M, representing Ghana, being a Ghanaian record holder, it brings a lot of pressure. You understand? So getting there, I was nervous. To be honest with you, I was really nervous. And to talk about the second fastest human in the world being by you. So, and I don't have the experience just like them. And if you could hear the commentator, he was like, yeah, I've been doing really well in the college system, but I have been running all by myself. You understand? So I don't have the experience that these guys have. Do you get it? So at that moment, they beat me to it, like psychologically. Yes, this guy is nervous. So my times and their times, yes, I could have won that race. Yes, if I've run that good, I could have won. But the psychological part
was big. Yes, I was just even thinking about the build-up series. I think in heat 5, you were in heat 7.
Yeah.
We'll be bringing you the full interview today at 10:30 p.m. on the JoyNews channel, so do make a date. But that's the note on it. You wrap up sports here.
Hi, this is Lexus Bill, host of Drive Time on Joy 99.7 FM. Listen, you don't have to worry if you miss Drive Time or Personality Profile. It's going to be live on our podcast page. Just log on to www.myjoyonline.com/podcast. You can listen to Drive Time, Personality Profile, and any other of your favorite shows on Joy FM on that page. You don't have to miss a show at all. Joy 99.7 FM, radio for discerning listeners.
That's it for our show for today here on The Pulse, on your home of independent, fearless and credible journalism. There's more news when you log on to myjoyonline.com. From entertainment, business, all the way to showbiz, we have it right there on myjoyonline.com. And talk of showbiz, it's time to talk more about it. Let's talk showbiz. I am MFA Pau. Many thanks for your company.
Hello, my name is Evans Mensah, and you can relive all the fun and excitement on Top Story, Newsnight, and of course, Ghana Connect via podcast. All you need to do is to log on to myjoyonline/podcast. Search for your favorite show and relive the moment. Joy 99.7 FM, your radio for discerning listeners.
you're welcome to Let's Talk Showbiz here on the Joy News channel. My name is Doreen Avi, and just so you know, we have few more days to Christmas. I'm really excited about it because few days to come, I should probably be wearing my beautiful red outfits with my hat. I don't know what you'll be wearing, but we'll show all of that. But hey, today we have a lot to talk about. Shatta Wale was on Daybreak Hits, and well, unfortunately, he was a bit late, but we had the opportunity to have a little conversation with him just to find out lessons after his whole back and forth. Medical was with him as well. We'll also get to see more about what to expect for the Samini Experience concert. Looks like there's a challenge ongoing. I'll try mine today as well because from what I've seen, my voice could be better than them. And GTA, that's the Ghana Tourism Authority, also said they are ready for December. So, have you gotten your vaccination done yet? If you haven't, some of the event you can't attend though. Anyway, just stay tuned because I'm here to bring you nothing but the best when you talk of showbiz. So, just stick and stay. If you just joined me, this is Let's Talk Showbiz, and we're starting with Shatta Wale and Medical, who was early on Daybreak Hits. And, well, the young men have been talking about their upcoming events and also lessons learned after, you know, being in, I don't want to say jail, but, you know, they spent some days at the police station. Yeah, they are out. They're doing amazing. We love them, but there was a conversation on Daybreak Hits, and I'd like you to enjoy with me.
Which lesson have you learned from your issue with the police?
Oh, discipline.
Discipline?
Yeah, discipline. You know, I think in this life, we all have to, you know, learn how to discipline ourselves well, and, you know, that's what is going to take us far. So I believe all the processes we went through, you know, from wherever to wherever, you know, came out, you know, with strong discipline. Because right now I feel maybe I might be doing something that I feel is right, but the system doesn't like. So I need to discipline myself and, you know, structure myself to the law, and, you know, we'll all abide by it and just move. You know. That's why I had the motorbike, because sometimes if I'm going and I feel there's traffic, I don't even do that ping, ping, ping anymore, because sometimes if you are doing it, somebody might think you are overdoing it, and it's all part of breaking the law. So I just want to show respect to.
Well, Medical, and you?
I would say you just have to be careful. Like, I've learned how to be very, like, extremely careful with anything that I do, any action I take, because you don't. Right now, I don't even know what might land me in trouble. You get me? Because honestly, whatever happened that put me in that place, I never even knew it was something. It was a crime. You get me? But I got to know that you just have to be careful in anything you do. You get me? So it'd be almost the same as what my brother said.
Almost everyone in Ghana, well, a section of the people thought that the law wasn't fair with you, especially you. I mean, with Shatta, we all knew what dragged him there. And even at a point, he even offered himself to be there. Said, I want to sleep there. In your case, people felt too sympathetic, like, he just displayed something. He didn't even know. Yeah. Did you feel sane?
Yeah, I mean, I didn't know it was an offense. I didn't even know, like, it was a crime. Because I knew brandishing of a weapon is when you're in public and then you pull out a weapon, people get threatened, and then you get me. Not when maybe you're in your car home and then you put something on Snapchat. So I was a bit puzzled and all, but I learned a lot from it as well. So right now I'll just be extra careful and advise anyone with listen to me to be extra careful as well, because you might never know.
Sadiq has got you on his show.
Oh, yeah.
That's beautiful.
I don't know, Sadiq. You know, I just realized that he was my junior brother. Like
he's lying.
Yes, I know. You can see the truth. You know, when I'm lying, he tells me I'm lying. I don't like it at all. Like, it's very deep. That is deeper than.
But that was the reason why I didn't wake up early. Like, they had a meeting. They finished like 4.
Yeah, 4.
I think he couldn't wake up.
So
early.
I was actually going to write.
So you should have come.
Yeah. So I was waiting for him because.
But if you don't chop, you don't go chop.
When I be deeper than blood.
So you have to move.
Do you have a blood covenant or something? No, it'd be question that he asked. I don't know.
Me and him, we have blood covenant. What I would just say is that they should give us some little time to just, you know, prepare everything proper. Because what the only problem we have right now is approving the drivers, and you know, it passed through a process, like, you know, so. They should just be patient. Like now we have 300 and something drivers, which is good. So I believe.
Wow. Is it only in Accra?
No, different places, like all over Ghana. You know, so that is why some of the locations you don't get drivers, because most of the drivers have not understood the app well.
Okay.
So one, I would just want to take this opportunity to tell the drivers that this is not an app that, you know, when you subscribe with your 20 Ghana cedi, it's just going to run.
Subscription is what? Just 20 Ghana?
20 Ghana. So when you're a driver, you subscribe for 20 Ghana cedi, you go online. The 20 Ghana doesn't run. It gives you time, like minutes. So until you get a ride, your money doesn't read.
Oh, really?
Yes. So you can be online, you know some of them.
Until there's no request.
Yes.
Until there's a request.
Until there's a request, that's where you start using your minutes. So that is one thing that I want to. And the prices too. Most of the drivers are also complaining that it's a bit low for them, you know, because with fuel.
Whilst it's good for us, it's bad for them.
It's bad for them, you know. So we want to find a place where we can, you know, satisfy the riders and satisfy the drivers at the same time. You know, we give like 3 minutes yesterday, and we're doing that this week. We're doing that like the whole of this Christmas festive. So if you're a driver and you do a couple of trips and we see, you know, you're working, you know, good, we just, you know, give you some minutes on top of your 20 Ghana. So
for now, how many cars are operational on top of your head?
So for now, let's say about 100 and something operating like in Ghana.
Okay.
Yeah, it's looking good. You know, the numbers are good. Like we have about 31,000 drivers now that are on board that needs to be approved. You know, and about 21,000 riders, you know, active. You know, so I think it's a speed up, and we are working on it.
And I'm surprised that you've never been late. Yeah. You too, medical, both of you. But each time I call you for an interview, you are here on time.
But I want to confess that it's Sadiq. It's Sadiq. If Sadiq is listening to Sadiq, thank you, man. Yesterday Sadiq kept me for 2 hours at 2 a.m. before I slept.
Are you cool with him now?
We are cool, Dada. That's it. We are cool. He called, we are cool, Dada. Me and Sadiq, we'll be cool, you know.
So for now, both of you, the DTB, is it a group?
Not really though. It's not a group though. It's a
gang.
You know, it's a family. You know, Empire.
It's a family.
Yeah. It's a deep family though.
Okay. Because of time, in fact, me a boss, so I don't even have the time.
I know when you bought, like,
you know what I'm going to do?
Yes.
Because I'm asking you guys to leave, as a matter of fact.
Oh, please, we beg.
No, I'm serious.
Don't do us like the other guy. Don't do us like the other guy. Please. We will leave.
He was your guy. I asked you to leave. Get out. Get out.
Right, so that was Shatawale and Medical. So just keep the dates in mind. You might want to go out there to support them. Those are our brothers, and any other event that you know of that you want to be part of this festive season. Now, talking about events, let's zoom into the Samini Experience concert, which will take place on the 24th of December at the Grand Arena. Now, are you a big fan of Samini? Now, can you sing some of his songs? Can you be Samini? Some people have tried their hands on. I was going to try too, but also try mine so that you can judge.